Hi, Vanakkam. Kaveri Hospital in the Nan Dr. Deep Chandraja. I'm a cardiologist and a cardiac electrophysiologist. அதாவது heart rhythm specialist. இதய துடிப்பு நிபுணர். Over to you.
Vanakkam, my name is Dr. Aslesha, Consultant Clinical Lead of the Department of Emergency at Kaveri Hospital, Chennai.
And we both together are going to talk about sudden cardiac arrest, the causes, the implications, and the first aid that we have to administer to someone if we come across a patient of sudden cardiac arrest. So, what is sudden cardiac arrest? Of late, we get to hear more of these terms, especially among few personalities, few celebrated personalities who have lost their lives because of sudden cardiac arrest. In India, the statistics says that there are about 6 to 8 lakh of sudden cardiac deaths every year. 10% of these deaths, of the proportion of the total deaths, are because of sudden cardiac arrest. Worst of it, the survival rate of sudden cardiac arrest is very dismal. It is only 5%. அதாவது 100 பேஷண்ட்க்கு சடன் கார்டியாக் அரெஸ்ட் வந்தால் அதில் 5 பேர் மட்டும்தான் உயிர் தப்பிக்க முடியும். It's so very less. Sudden cardiac arrest, what is the meaning of sudden cardiac arrest? The literal Tamil translation would be திடீரென்று இதயம் நின்று போவது, திடீர் இதயம் செயல் இழப்பு. அதாவது the heart keeps pumping blood 60 to 100 times a minute. And the blood circulates all over the body. The most important organs, ரொம்ப முக்கியமான organ, ஒன்று வந்து மூளை. So sudden cardiac arrest வரும்போது the blood supply to all the organs is cut off. So that patient, sudden cardiac arrest வந்ததுனால the blood supply to the brain is also cut off. The patient becomes unconscious. The breathing centers எல்லாம் brainல தான் இருக்கு. So unconscious வந்ததுனால அதுக்கப்புறம் blood supply இல்லாததுனால the patient loses the breathing also. So இதை தான் நம்ம வந்து யூஸ்வலாக நாங்கள் we come across in public when people call us up for an emergency ambulance stating that ஒரு person பேச்சு மூச்சு நினைவு இல்லாமல் படுத்திருக்காரு, சடனாக கொலாப்ஸ் ஆயிட்டாரு, ப்ளீஸ் கம் அண்ட் ஹெல்ப் அப்படின்னு சொல்றது. திஸ் இஸ் பிகாஸ் ஆஃப் சடன் கார்டியாக் அரெஸ்ட். அதாவது திடீரென்று இதய துடிப்பு நின்று போவது. இதுக்கு காரணம் என்னலான்னு பார்த்தீங்கன்னா தி மோஸ்ட் இம்பார்ட்டன்ட் ரீசன் வந்து ஹார்ட் அட்டாக். ஹார்ட்க்கு பிளட் வெசல்ஸ் வலது பக்கம் ஒரு ரத்த குழாயும் இடது பக்கம் 2 ரத்த குழாய் உள்ளன. These blood vessels keep supplying blood. இதில் blockage 60-70% blockage இருக்கலாம். But at times what happens is the plaque, அதாவது அந்த blockage 67% blockage வந்து டக்குன்னு ரப்சர் ஆயிடும். ரப்சர் ஆகி it causes a clot. And the clot causes 100% cut off of blood supply. அதனால அது கீழே இருக்கிற அந்த ஹார்ட் மசில்ஸ்க்கெல்லாம் blood supply இல்லாம போயிட்டு இமீடியட்டா ஹார்ட் ஸ்டாப் ஆயிடும். So that is sudden cardiac arrest. இதை தவிர sudden cardiac arrestக்கான காரணங்கள் dangerous heart rhythms, ஆபத்துக்குரிய heart rhythms. இது என்னன்னு பார்த்தீங்கன்னா மெயினா ventricular tachycardiaன்னு சொல்லுவோம் அல்லது ventricular fibrillation சொல்லுவோம். இந்த abnormal heart rhythms வந்தா the patientக்கு sudden cardiac arrest வரதுக்கான வாய்ப்புங்க உண்டு. sudden cardiac arrest வந்தாச்சு, இப்போ என்ன பண்றது? இது எங்க வேணா நடக்கலாம். இங்க ஃபார் எக்ஸாம்பிள் நீங்க மேரத்தான்ஸ் நீங்க பாக்குறீங்க, அங்க சடன் கார்டியக் அரெஸ்ட் நடக்கலாம். ஸ்விம்மிங் சென்டர், ஸ்விம்மிங் காம்படிஷன்ஸ், பப்ளிக் ஸ்பீக்கிங் அகைன் இஸ் a stressful activity. இந்த மாதிரி பர்சன்ஸ் ஆஃப்டர் a public speaking or during a public speaking sudden cardiac arrest வரலாம். Even during sleep it can occur to anyone at any age and at any time. So once sudden cardiac வந்துச்சுன்னா என்ன பண்ணணும்? That's where Dr. Aslesha will help us and tell us sudden cardiac arrest வந்ததுக்கு அப்புறம் how do we manage? என்ன பண்றது? Yes, Aslesha.
Thank you, Dr. Deepchan. So, sir சொன்ன மாதிரி தான் sudden cardiac arrest வரது can happen anytime. It can happen anywhere and in any place. So, the first thing that a person needs to be equipped with is to recognize that the person is in cardiac arrest. So, we find a lot of people do not. There is a delay in recognition of cardiac arrest. Thereby, there is a delay in giving the required first aid for cardiac arrest patient when they are there. So there are two things that we teach. There is a program that we have. It's called Restart a Heart, and in that program, we actually we teach people. It's for the common people, not for medicos alone. Anybody, a school child to a college-going person to an MNC worker or a officer, anybody can take that course up. And in that course, we teach them how you recognize somebody not having a pulse, not having breathing effort, and recognizing that he or she is in a cardiac arrest. And once we do that, we tell you techniques. The cardiac massage நீ எல்லாருக்கும் தெரியும் ஆனா எப்படி கொடுக்கிறது தெரியாது. So several times நம்ம கேட்கறம் போது they will be pumping on the left side of the heart, on the chest when somebody is unresponsive. But அவங்களுக்கு தெரியல that heart is in the center and pumping needs to be done in the center. இது எதுக்காக நம்ம சொல்றோம்னா out of hospital cardiac arrests are very common like you mentioned, and only 5% of them actually survive. And in India it is lesser because we do not recognize the cardiac arrest there. Here, if we do get people who are skilled enough to recognize cardiac arrest and give the compressions and the ventilations on site, and then call for help in the meanwhile when ambulance and paramedics or the hospital person arrives, this is given to the person or the person who has just collapsed. It maintains blood supply to the brain, and the pumping acts as the blood is going to the vital organ, which is the brain. We get only about 10 minutes from a person's collapse for the brain to keep its faculties intact. So, if we go beyond 10 minutes without starting resuscitation, which is cardiopulmonary resuscitation, cardiac massaging, அது கொடுக்காம இருந்தோம்னா the person may not really get, I mean, even if he reverts with a pulse, எல்லாமே பண்ணி கூட pulse வந்தா கூட there will be irreversible brain damage. So we want everybody to recognize that this has happened to a person, whether he's alive or dead. Recognize that first, and then give that immediate first aid, which is nothing but compressions and breath. Cardiopulmonary resuscitations. ஒரு 30 compressions கொடுப்போம், 2 breaths கொடுப்போம், ஒரு 5 cycle அப்படி பண்ணிட்டு திருப்பி pulse check பண்ணுவோம். அந்த situationல the reversibility is very high. So if somebody recognizes and provides this first aid, it will make a huge impact in reviving or reverting patients who have had out of hospital cardiac arrest.
Very nice. So Dr. Aslesha pointed out a very important fact. To start with, the public or anyone should learn to recognize sudden cardiac arrest. அதாவது recognition of sudden cardiac arrest is the first step. அதாவது pulse இல்ல, breathing இல்ல, and a few techniques how you would go about understanding pulse illa, breathing illa, you see that, and then you take a decision, yes, patient sudden cardiac arrest irukanga, then you call the ambulance, of course, and then as she highlighted, the most important, the other step is cardiopulmonary resuscitation. So Aslesha, can you throw more light on this cardiopulmonary resuscitation? We all understand it as CPR, and what is the CPR?
So cardiopulmonary resuscitation very edume illa, it is externally pumping the heart,
okay,
and giving breaths, that is acting like an external heart and lung for the person who's not breathing and whose heart is not pumping at that moment. Either now, how do we do this is as a single rescuer person I can do it. If I have people around me, I can make them do it, but
okay,
this technique has to be learned. Somebody has to guide them. So usually the person would be who say I'm over there, I have recognized a person in cardiac arrest. First thing is to put them on a flat surface and then expose their chest so that I can give the adequate CPR that is needed. Then we put what we call as high quality CPR is nothing but the compressions have to be at a rate of 100 to 120 beats per minute. So normally count பண்ணுவோம் 1, 2, 3 when we're giving the compressions. The 30 compressions meaning pumping the heart 30 times, and then we give 2 breaths, mouth to mouth breathing கொடுக்கலாம் if you don't have any device, or we have something called as a pocket mask, which is easily available. You can keep it, any lay person can buy and keep it with them, they can use that, or simply putting a handkerchief over the mouth if you don't want to directly go. In COVID times many people are apprehensive, sometimes blood vomit is vanda, we say even if you can't give ventilations, continue giving compressions. So breath compressions would be at the rate of 100 to 120 beats per minute. It should not be too fast, it should not be too slow. Again, that will circulate the blood volume in the body. Second is we expect that the entire chest wall goes at least at the depth of 5 centimeters, and it's allowed to recoil. That has to come back to normal position for it to go back, because this is important for the heart to filling solo, for blood to come back into the heart to be recirculated. This is important. Recoiling is important. And then subsequently, we also ensure that there are no interruptions. So several times we come across patients coming to us with their loved ones who've probably collapsed, where they give compressions, but they don't know how much they have to give. So ஒரு 5 வாட்டி பண்ணிட்டு பார்ப்பாங்க இருக்கா இல்லையான்னு. That would not be enough. So you need to ensure all of these minimal interruptions are there. The quality is good. We push hard, we push fast. Allah, we have to take care along with the breaths. Breaths எதுக்காகனா, the lung, obviously the circulating blood volume needs some amount of oxygen for maintaining functions in the body. For especially somebody who's dead, we need that. So we don't want hypoxia or lack of oxygen to cause brain damage. So this is why those two breaths are important.
Very nice. So ரொம்ப நல்லா சொன்னாங்க. Quality chest compression is what we need to understand. We need to give a good quality chest compression. Chest compression கொடுத்தா மட்டும் பத்தாது. அதை வந்து கரெக்டாக 100 to 120 beats per minute அந்த டைமிங்கில் adequate டெப்த்துக்கு அந்த chest recoil, அப்புறம் மோஸ்ட் இம்பார்ட்டன்ட் அவங்க சொன்ன மாதிரி uninterrupted continuous chest compressions. எதுக்கும் வெயிட் பண்ணக்கூடாது. You keep doing the chest compressions, அவ்வளோதான். இன்னொரு இம்பார்ட்டன்ட் விஷயம் அவங்க சொன்னது வந்து இந்த breaths. 30:2 rate, 30 compressionsக்கு 2 breaths. நார்மலா பப்ளிக் இருக்கிற அந்த அப்ரஹென்ஷன் எல்லாருக்குமே இருக்கதான் செய்யும். எப்படி ஒரு தெரியாத ஒரு இண்டிவிஜுவலுக்கு நம்ம எப்படி மவுத் டு மவுத் ப்ரீதிங் கொடுத்து அவங்களை ஹெல்ப் பண்றதுன்ட்டு ஒரு சிம்பிள் டெக்னிக் சொன்னாங்க. ஹேண்ட் கர்ச்சீஃப் யூஸ் பண்ணிக்கலாம்னு சொன்னாங்க. இட்ஸ் a very nice technique. Just ஒரு hand kerchief போட்டுட்டு அட்லீஸ்ட் you can maintain some sort of a thing or a wheel sort of, and then you can go ahead and give those two vital breaths. Remember, the breath that you give also has enough oxygen in it, and that can help that the person enough. You are saving an individual's life, so it could be very vital for the person. So that is about the chest compressions that Dr. Aslesha was highlighting. What more is in CPR and is in this basic life support, Aslesha?
So
in addition
along
to this?
with CPR, there's something called external cardiac defibrillation.
Okay.
So previously we never had those devices at even public or social places like malls or theaters or companies. But now I think most places have it. They have the external automated external cardiac defibrillators available. It's a small device. It is an automated device, like the name itself suggests. It's a shock machine. So it's very easy to use. You open the device and it will tell you, it will prompt you. So you don't again have to be a medico to know how to use it. It gives you prompts on what you're supposed to do. You switch on, you attach the paddles, because that is important to restart certain rhythms of the heart. So cardiac arrest can be because of various rhythms, can be shockable or non-shockable. Now a lay person doesn't know how to recognize that. So this device came into play. And when you attach the paddles to the person's chest directly, there will be a command where it will tell you to stop CPR because it's analyzing rhythm. Once that analysis of rhythm happens, in that it will tell you whether it is a shockable or a non-shockable rhythm. If it is a shockable rhythm, it will tell you to deliver a shock. So there's a shock button which will blink. So you just have to press that shock button, ensure that time nobody is touching the patient, because it is detrimental if you get shocked when you're saving somebody. So do not touch, do not allow anybody else to touch, and then just press the shock button. It will say shock delivered, and then it will tell you to even resume CPR. So you can continue resuming CPR.
Okay.
So automated external defibrillator is very good in out of hospital cardiac arrest to revert a shockable rhythm. And we know that in shockable rhythms, the reversibility is higher than that of non-shockable rhythms.
Very nice. So, in addition to these chest compressions, the other important component is defibrillation. So, timely defibrillation is again an essential part of this basic life support, link of basic life support. If you can administer this external shock at the right time, நான் சொன்ன மாதிரி இந்த சடன் கார்டியக் அரெஸ்ட்க்கு dangerous heart rhythms is a very common reason. Ventricular tachycardia and ventricular fibrillation சொல்றது. So இந்த மாதிரி personsக்கு you administer this timely defibrillation. It can be really life saving for those persons. And yes, I have noted that. நானும் பார்த்திருக்கேன், நீங்களும் பார்த்திருக்கலாம் பல இடத்துல. Nowadays they have these AEDs, gym complexes, swimming pools, competitions, sport competitions, marathons. அப்போ இப்போ all ambulance are equipped with this AED machines. A lot of like cinema complexes and gyms, auditoriums, இங்க எல்லாமே AED machines இருக்குது. So if you are trained about basic life support and you know how to handle these things, wherever in general public, if one among yours or one in front of you goes into sudden cardiac arrest, and then you can of course be in that privileged position to save their life. So that timely defibrillation helps. And Aslesha, you talked about cardiopulmonary resuscitation, defibrillation. How does a person, if a person wants to learn about these things, I want to learn. If someone in my family has sudden cardiac arrest, I want to learn this technique and help them. There could be many people like me who want to learn. So how do we direct them? How do we send them? Where do we go? Where do they go and learn these things?
So there are institutes that do provide training for basic life support, which is AHA certified. So you have American Heart Association certifications for BLS. But for the commoner people, we at our own hospital have a program called Restart Your Heart. So
Okay.
with Restart Your Heart also, there are people who inquire, say a corporate company or a school or a college. We've done it so far for many schools, colleges, as well as corporate companies. Recently, we did for a football playing group as well, and they're interested in knowing this technique because they want to know how to. So you can get enrolled on such a technique on such a program. It's a one-day program. It will teach you the basics of what we're going to do. It will give you enough hands-on to experience how you're supposed to do it in real life scenario. It's a mannequin-based practical session learning along with a little bit of theory aspect where we make you understand why you're doing it. So if it is done in a sequential order, like you said, early recognition of cardiac arrest, early initiation of CPR, early defibrillation, and then of course shifting to a higher center for further care. This is the chain of survival in a patient with cardiac arrest. So somebody who wants to get certified as a basic life support provider, please do get in touch with us, as well as we can definitely help you all with the training for such.
Okay, so that looks like there are a lot of programs available which are American Heart Association certified programs. Each are one-day courses. And that is a beautiful term that you put, Restart a Heart. And Restart a campaign is an initiative by the Kaveri hospitals even to reach out to people who want to learn this technique. You did mention that you have met the schools, colleges. How early do you think a student can learn? Which standard? 8th, 9th, 10th? When?
So we say anybody about 10 years of age, we're happy to teach.
Wow. So that's great. So anyone about 10 years of age can learn the basic life support. So right in the schools, that's the best place where you can incorporate this into the society. That's where you need to get this basic life support, the concept and the technique right at the school age, so that these kids, when they grow up, they can be really helpful to our society members if someone has a sudden cardiac arrest. So that is very good. And I think, Vaslesh, you also were mentioning me just before the program, you are reaching out to auto drivers
Yes.
tomorrow, right?
Yes, we have a program for the auto drivers tomorrow. We're
Yeah.
expecting about 30 to 40 people,
Yeah.
and they're very interested in learning the basic life support. And we're doing it as so weekly one session for the next 3 weeks, targeting auto drivers to learn BLS.
Yeah.
Because many a times our ambulances are not able to get to patients at a particular
Yeah.
location, and the people who actually transport or act as ambulances are those auto ambulances.
Yeah.
So if the auto drivers are well equipped with knowing BLS, I'm sure they can make a big deal of difference to the person.
Yeah,
with
that's
cardiac
beautiful. That's a very beautiful initiative, Aslesha. And sure, we have many more plans up our sleeve for the Restart campaign and the Restart Foundation. We will be reaching out more to the colleges, students, and a lot of the community people so that people learn basic life support. And last of our discussion is on prevention of sudden cardiac arrest. So, how do you prevent sudden cardiac arrest? Vandache, you know this is the first aid. The first aid is a basic life support and cardiopulmonary resuscitations. So, how does one prevent sudden cardiac arrest? That's again a very important question. And how does one recognize it before it even occurs? அதாவது சில அறிகுறிகள், symptoms, red flags what we call, chest pain, மார்பிள் செஸ்ட், நெஞ்சு வலி வந்து எங்க வேணா வரலாம், தாடையில இருந்து வயிறு வரைக்கும் எங்க வேணா வரலாம். இந்த அசிடிட்டிங்கிற ப்ராப்ளம் வந்து do not ignore it as just an acidity. It could be a heart attack. breathlessness, palpitations, இதுக்கு முன்னாடி எப்பயாவது மயக்கம், அன்கான்சியஸ் எபிசோட்ஸ் வந்திருந்தால் இதெல்லாமே சிம்டம்ஸ், premonitory symptoms னு சொல்லுவோம், which can lead to sudden cardiac arrest, or which is talking about something that's inside your body that's not going good. So இதெல்லாம் symptoms இருக்கும்போது please go to the doctor, evaluate yourself. And again, anyone more than 40 years of age with diabetes, high blood pressure, history of smoking, obese patients, right? So they are all at very high risk of getting a heart problem or a coronary artery disease, which we saw is directly related to sudden cardiac arrest. So all these individuals with these risk factors need to go out, evaluate themselves with the general physician or their family physician. They will do the necessary tests and they will find out if whatever are you at a risk of any event in the future or not. Then the other thing, how do you prevent this? Have frequent health checkups after 40 years of age. And then you will understand, get in touch with your doctor. They will let you know that you're at risk or not, and they will give you the perfect guidance what you need to do, right? So I think that's where we conclude our discussion on sudden cardiac arrest for today. Thank you, Dr. Aslesha. It was so very informative on the basic life support and the methods that we need to adopt and how we need to learn this technique, and our own initiative from Kaveri Hospitals, the Restart campaign, and things like that. Thanks a lot.
Thank you so much, Doctor. Have a nice day.
Thank you. Thank you, everyone.